years of experience. So today, what I'm going to talk is the concept of preconception and why it is important. So now the time has come up where the increasing age of marriage or the lifestyle diseases or the poor nutrition which we are consuming each day has made us to think there is a need or there is a time coming up for preconception counseling. And there are clinics who are doing this. As an obstetrician, I am also doing the preconception counseling where a couple who wants to be parents next, they want to know everything beforehand about their child and a healthy pregnancy outcome, and all the things has to be decided before they conceive and before she delivers, and all the antenatal journey, everything they want to know beforehand whether she is ready physically, mentally, emotionally to have the baby. So this concept of preconception is very important, and the preconception nutrition and lifestyle is important as it maximizes the gains for the maternal and health of the child. The concept of preconception care is gaining popularity quite recently as more and more people are getting conscious about planned pregnancies. Now, we don't want any kind of unplanned pregnancies, or we don't want any unwanted pregnancy. And the main aim remains the healthy outcome of the baby and the mother. The increasing rate of infertility is another reason why the field of preconception nutrition and lifestyle is advancing at a constant rate. Now, when we say what exactly preconception care means or a preconception counseling, so the preconception care entails providing women and the couple with biomedical, behavior, and social health interventions prior to conception. The discipline covers a wide field, often beyond the boundaries of general medicine. So, initially, this work used to be done by the physicians. Now, as an obstetrician, this lies in our domain where we counsel the couple before she is ready for conception. The immediate circle of care in preconception is the couple, their interactions with the surrounding as well as with each other, because they need to understand the need of the hour and they need to have the proper interaction among themselves also. So the aims of preconception care comes to improve the health status of the couple, to reduce the behavior, individual and environmental factors that may contribute to the poor maternal health or impact the newborn negatively. Now, to improve the maternal and the child health in both short term and the long term time, and to prevent and control some hereditary as well as non hereditary diseases which may affect an individual at birth or at some stage of the later life. Now, to secure the optimal health conditions in both parents that maximizes the chance of conception and reduces the chances of abnormal birth defects or any kind of prenatal death, to ensure the optimal physical and the mental health of the woman and her partner during the onset of pregnancy. We want to prepare them properly before they land up with pregnancy. Now, to check the health of a woman planning to conceive, to identify disease that may have been left undetected somewhere in the past, to evaluate the risk that may be involved if the woman conceives or the risk if the woman does not conceive. Now, to promote the prenatal health by planning the surrounding long before being conceived, to benefit women who are being treated for a condition and they want to conceive in parallel, or a women who are being treated for a condition that has an unplanned pregnancy. Now, coming to the purposes of preconception care, why? What are the purposes? What we want, what we are looking forward to it. Establish a healthy lifestyle for optimal health. We want to have a proper healthy lifestyle, and that is not a one-day job where we can provide to the patient. It is a long journey, and the lifestyle is a important, or I would say, it is the basic amenity which needs to be changed before we plan a healthy outcome of a pregnancy. Identification and treatment of the risk like substance abuse, any kind of alcoholism, or any kind of medical conditions, any kind of addictions, and conceive without risk that can be avoided. Prepare physiologically for and psychologically, I would say, for the coming up pregnancy. And why we need the preconception care? It reduces the child and the mother mortality. We can control the unintended pregnancy, or I would say the unattended pregnancies even. It can prevent complications during childbirth and delivery. To prevent the stillbirths or premature births, we want an optimum level of birth weight when we deliver a baby. And to prevent the birth defects and neonatal infections, reduces the risk of vertical transmissions of any kind of sexually transmitted disease like HIV, reduces the chances of some kinds of cancers and cardiovascular chances in childhood or the later stages of life. So, with this topic, what all things we want to cover is the nutritional condition, the vaccines for the preventable diseases, genetic conditions, infertility, early unwanted or repeative consecutive pregnancies, then STI, or I would say STDs, mental health of the female, psychoactive substance abuse, tobacco use. So these are the conditions, these are the things we are looking forward in this preconception counseling, and we want to treat all these things before we want the couple to have a healthy outcome of the pregnancy. Now, coming to the nutritional conditions in India, when we talk about nutritional condition, the most common thing in the nutrient which is being needed in the female body is deficiency of iron, which is known as the anemia. And anemia is preventable, and it has to be prevented and treated well in advance before we want our mother to land up, or the lady to land up in the pregnancy and to have a healthy outcome. Now, diabetes is another one. So, diabetes and anemia screening is very important while we plan a pregnancy. It gives us a general overview of health of the person. Now, supplementing the diet or supplementing the lady with the supplements like iron, folic acid, and on a regular basis so as to have the healthy outcome. Now, monitoring the nutritional intake and monitoring the response of the body, energy and the nutrient dense food must be promoted. Diabetes management is of prime importance, and it has to be taken care well in advance, well in time, and we need to either control it on diet or on the drugs. Now, promotion of exercises at it, as it helps a lot. Lifestyle comes up with even exercise, and active lifestyle has to be promoted. It should not be a sedentary lifestyle which is good for healthy outcome of the pregnancy. So now there are few conditions, or there are some diseases which need to be ruled out before the lady lands up into pregnancy, and there are vaccines which can prevent the diseases. So we have certain vaccines which can be given in preconception time, like the vaccination of rubella, like a vaccination for of tetanus, or vaccination of diphtheria, and vaccination of hepatitis B. So these vaccinations can be done in the preconception time. Now, another main domain is the genetic conditions. When while we counsel a patient, we take a proper detailed history of the family, and the family history is very important, and it is very accounting to determine any kind of genetic condition or any kind of the risk factor. Then the family planning conditions, then the genetic counseling, appropriate treatment of the genetic conditions, and the one more and the foremost thing is screening of the people who are at high risk, and we take them to another level of test, and we do different kinds of hormonal analysis or any kind of markers to rule out any high risk if the pregnancy is planned at a later age, or we say more than 30 years of age if she is conceiving for the first time. There are certain battery of tests which needs to be performed while she conceives. Now, coming to one more important thing is infertility. Now, understanding infertility and their preventable or unpreventable causes, diagnosis and screening of couple in 6 to 12 months of attempting pregnancy, or we define infertility as unprotected sex for 12 months time. So, counseling for couple, counseling of the people who are suffering from unpreventable subfertility or infertility, early unwanted or repetitive consecutive pregnancy, like teaching about sex education in school. That's one and the foremost uh, level where we can educate our young girls to about to have a healthy lady in her later age and to land up into a healthy mother. Now, educate awareness about contraceptions and their correct use, engaging boys and men to respect consent in sex, educating women and couple about the dangers of short birth intervals, Then coming to the sexually transmitted diseases or infections, so we need to teach them about the safe sex practices or to prevent the STDs or STIs. Promoting contraceptions, the use of the barrier contraceptive is the best method to prevent the sexually transmitted diseases. Now, screening of STDs for high risk groups. Family planning must be done beforehand. It is not a good practice to conceive and then get it aborted because you have your family completed. So it has to be done beforehand, and there should be proper measures to be taken before she lands up into another pregnancy. Then counseling about HIV infection, antiretroviral therapy for preventing the vertical transmissions from mother to the child, lifelong antiviral therapy for people who are already infected. So the concept here is to prevent any spread of any infection to the baby who is there in the womb of the mother, and the transmission is vertical from mother to the baby. So we want this connection to be breached. Now, another important thing is mental health nowadays, where everybody is stressed out, everybody is in that dilemma of workload, family pressures, so many things, late age of marriage, then the fear of PCO, infertility. So the mental health is somehow complicating the lifestyle. So the psychological counseling to the people who are pregnant or planning to get pregnant, we need to counsel them properly. And in females, because of some hormonal issues, or because of the weight gain, or because of the work pressures, or because of the family pressure, there are depressions which are very common, there are anxiety which is very common. And sometimes due to failure to conceive, there is a depression, or sometimes it could be a postpartum depression after the delivery of the baby. Now, community networks improving women empowerment, talking to them, sharing them, caring for them, gives that cozy environment, or physically or mentally healthy environment where she can share and care. So in that way we can improve the psychology of the female. Providing education for women of childbearing age, and education is the only thing which can be achieved by this. Now, the psychoactive or psychoactive substances, there should be a proper screening for substance abuse. There is a screening of substance abuse, and interventions should be taken whenever it is being needed, and it should be encountered at the earliest in order to have a proper result. Now, treatment of all substance abuse disorders, special family planning assistance if one of the partners are not into substance abuse, establishing and discouraging the use of substance abuse in teenagers itself. So the practice starts at adolescent age group. They need to be taught, they need to understand the use, they need to know the side effects. So the only thing to do is communication. When we start communicating to the teenagers, when we start communicating in the adolescent age group, when we are in family or as a doctor or as a society, it's a collective practice, and it is a collective platform to teach the young girls and even the boys about all the substance abuse which is harmful or which can be hazardous in the later age groups. Now, another common substance abuse is tobacco use. So, screening of the tobacco use for women and girls, as it is harmful in case of pregnancy. Now, providing support pharmacotherapy for people who are addicted to tobacco. Now, advising of all non smokers and awareness about secondary smoking. So, there is a role of active smoking and as well as passive smoking. Both things has to be taken care and has to be taught and completely communicated to them. Now, what are the key points for healthy pregnancy? When we talk about a healthy pregnancy outcome and a patient is coming in preconception time, the first and the foremost thing is the folic acid administration. Then, second is the role of vaccination, as I told, to the girls and the women who wants to conceive. Then there are certain basal levels of the blood test where we can rule out any kind of infection, any kind of anemia prevailing, or any kind of other disorder. Then the nutritional supplement, yes, we need to tell them about a healthy and unhealthy diets, and so that we can give the choices of healthy options to her, and a healthy girl can only convert it into a healthy adult or a healthy mother. Now, the healthy behavior in terms of mental health as well as the physical environment she is staying in. Now, coming to the pregnancy care for women. when we talk about pregnancy, automatically the nutritional requirement, the emotional support, everything becomes even more higher. So the balanced diet with adequate amount of water, there is a role of water intake which is very crucial and is important. Then the use of the nutritional supplements, either in form of folic acid in the first trimester, or we talk, let's say, the iron and calcium and proteins in the second trimester, and so on. Then smoking of cigarettes is extremely harmful and should be avoided. Then avoid caffeine and alcohol. Avoid any kind of harmful medications. Instead, for less harmful substitutes, avoid contact with any kind of chemicals which can harm you. Avoid the contact with excrements of pets to prevent the chances of infection. Use of comfortable clothing, and do not attempt hard exercises. Go for the milder types, specially designed courses instead, I would say. So the diet has to be properly taken from a dietitian, and the exercise part to be totally taken care by your physiotherapist or your gynecologist. She is the first and the foremost companion, or the doctor who acts as a physician, who acts as your caregiver in all the aspects as a whole. Now there are certain things for men also. As a couple, if comes to us in preconception counseling or preconception clinics, so there are certain points for even men, like the smoking is dangerous for men as well as women. So we say the caffeine and the smoking, both things has to be to a lowest level, or I would say they should quit it. So this is applicable to men also. So avoid increased temperature about around the genitals, like laptops or any electronic item that still harms the fertility part. Some medications may cause trouble in fertility and desire. Cut on them, and you need to have the minimum level. And the drugs and the medicines, I would say the drugs in form of medicine, has to be on the prescription of a doctor or after consultation with your doctor. Stop consuming alcohol and steroids. There is a frequent use of steroids for, like, for gyms or for any kind of health, fitness industry. They are taking, men's are generally they are taking the steroids, so it has to be minimized or it has to be stopped before they plan any kind of conception. Then go for the relaxing schedule instead of using steroids or alcohol. So you need to divert your mind state to some other thing, while you quit any kind of addictions. Then maintain a healthy weight. Weight gain is harmful for even men. There is a male infertility, and excessive weight or the excess of BMI is one of the basic reason. So whenever you think about parenting, there are things which you need to take care of. And as a parent, I would say both men and women, as a collective, as a team, and your obstetrician is your companion in your pregnancy, in your preconception time, and throughout your pregnancy journey. And at the end, as a team, there is a healthy baby and a healthy mother together as the outcome of everybody. So this is the need of our, we need to have the preconception things, and the proper counseling and communication with the couple makes them to have a healthy child.